shattered dreams for the future. Due to the economic crisis that followed hot on the heels of the pandemic, many people lack job prospects. That can put a strain on mental health. In Mexico, an online platform offers free counselling. In Ghana, one woman successfully led her company through the hard times and managed to save more than just her own job. Also, one new scientific study suggests that COVID-19 vaccines can affect menstruation. Should pregnant women still get the shot? But first to Colombia, where one young college graduate can't find any work. And she's not the only one.
Amanda Libertad walks the streets of Bogota like she used to as a student. Because she currently has little else to do, she's among the 30% of young Colombians who haven't been able to find work since the pandemic. Amanda scans the internet and social media looking for job offers. She's exhausted pretty much every avenue.
It's hard because you go through the application process and they don't tell you why you didn't get the job. I'm even applying for jobs I'm not qualified for because I don't know what else to do. They always want 2 years experience and I only have 6 months.
Colombia's economy is still reeling from the pandemic. Unemployment is at 11.3%, while 58% of those working only have a short-term contract or casual labor. Experts say young people are the worst affected.
For first-time job seekers with no work experience, it's really tough. Those who do have some experience already have a network of colleagues. Young people don't have that. They're just starting to develop contacts. So the situation is really hard for them.
The crisis is also starting to take a mental and emotional toll on Colombia's unemployed youth.
I have constant insomnia now, not just a few bad nights. I go to bed at 10, but only sleep till 3 a.m. and I get up at 6. When I go to bed, I'm thinking, what am I going to do? But what can I do? I have no money, no job, and all I can think is what's in store for me. When am I going to start my career? How will I earn an income?
Experts are alarmed by growing levels of insomnia and anxiety among young people. They say it's an emergency that requires urgent action. A study conducted by the World Health Organization and local psychologists showed that 70% of young Colombians now have difficulty sleeping.
Young people feel desperate and deeply insecure when they think about their future. They have no way of knowing with any reasonable amount of certainty what the immediate future holds for them. And they feel they have no power to change that. So they're extremely worried and disappointed with their lives.
Most young Colombians feel they're facing bigger challenges than those experienced by their parents' generation.
I think I'll look back on my youth with great sadness. Your 20s are supposed to be so fantastic, but I think I'll just remember how sad I was. I remember me crying and being anxious. I thought my 20s would be awesome. It's a very bad time to have just finished studying in Colombia and have no work experience.
Things are especially tough for young people who don't get any support from their family. The pandemic has presented Colombia with a whole new set of challenges.
In Mexico, anxiety disorders and depression became more widespread during the pandemic. Sandra Vargas wanted to help and founded Apoyo COVID. The initiative provides mental health care that everyone can access for free online.
At the end of March 2020, prior to any lockdown measures in Mexico, Sandra Vargas already predicted the emotional stress the pandemic would bring in its wake. The psychoanalyst responded by creating Apoyo COVID, or COVID support, an online platform providing free therapy. Just fill out a form and get a list of professionals available 24 hours a day. The immediacy and anonymity of the platform were key to people overcoming inhibitions about seeking psychological help.
The accessibility was important. If we have to talk to someone on the phone to make an appointment, we tend to put it off because it's embarrassing and scary. The lifeline was there.
In Mexico, the number of people experiencing mental health problems tripled during the pandemic. Anxiety disorders affected up to half of the population, and almost a quarter of all Mexicans developed signs of depression. Pablo Sieva, who is in the program, is one such case. Often it was the pandemic that triggered or worsened existing mental health issues.
It manifested itself in the form of anxiety. I started eating more and I gained more weight. I suffer from chronic depression and had a major breakdown. I didn't feel like doing anything, not even going to the supermarket.
Apoyo COVID quickly gained momentum. Marco Garcia is among its 90 volunteers. He feels the project is a good opportunity to overcome prevailing taboos in Mexico concerning mental health.
Here it's deeply culturally ingrained that if you ask for emotional support, you obviously can't take care of your own problems. That collective stigmatization stops us from asking for help. It's seen as a weakness.
So far, the project's webinars have helped some 2,000 people. They've given individual sessions to more than 600 patients from across Mexico and also from other countries. Most of them contacted Apoyo COVID during a time of crisis, like Monica Cervera did when she called from the Mexican state of Oaxaca. The pandemic triggered the separation from her husband.
I was in crisis that day. I couldn't stop crying and I locked myself in my room. My children were in the living room. It helped me a lot at the time. Apoyo COVID really saved me because I felt so lost.
Despite the increasing demand, in the last decade, the Mexican government has allocated only 2% of its total health budget to the treatment of mental health issues. And most of it goes into the maintenance of psychiatric hospitals.
We're barely managing to deal with diarrhea and flu. We still have a long way to go with mental disorders. They're not priorities.
Right after her training at the Mexican Psychoanalytic Association, Sandra Vargas specialized in crisis management. She offered psychological support to those affected by the 2017 earthquake in Mexico City. Life is finally returning to normal in Mexico, and the Apoyo COVID platform is receiving fewer requests. But it serves to strengthen the network of therapists who are interested in reaching out to a population in need.
It's a commitment that has to come about in a very organic way, referring people to us who need low-cost mental health care. Sometimes we think there's no one there to help. Listening to someone can really save lives.
Sandra Vargas and Apoyo COVID have helped to improve mental health in Mexico during the pandemic and will continue their work going forward.
And now to a question that concerns roughly half of the world's adult population. Does the COVID vaccination have an effect on menstruation? According to a new study, the answer is yes. DW reporter Hangxuan Li talks to one of the study's authors, Dr. Catherine Lee of Washington University in St. Louis.
Hi, Dr. Lee. So, according to your study, how did COVID vaccination affect people's menstruation? What were the major findings?
Our study took place as an online survey, and what we found in our survey, which I should point out is not representative of the general population because people could opt into our survey. But what we found was around 40% of people experienced a heavier period after one or both of their COVID vaccines. Around 40% had no difference in the heaviness of their bleeding. And the remainder of people were about the same or maybe slightly lighter.
How about people who do not usually menstruate, for example, postmenopausal women or people on gender-affirming hormones?
We also asked people who normally wouldn't have a period for any number of reasons, including long-acting reversible contraceptives like IUDs that suppress bleeding, and people who are on gender-affirming hormones. A lot of those folks noticed that they had breakthrough bleeding. And the third group that we really focus on in this paper is the experiences of postmenopausal people. So people who are at least 12 months past normally having a period, who noticed that they had breakthrough bleeding after getting their COVID vaccine.
So what is the mechanism causing these changes?
Of course, we have our hypotheses, and what we think is happening is that the vaccine is making this big immune response. That's why the vaccine is so incredibly effective. This is involving a lot of inflammatory processes as well. And we know that the uterus is already an important immune organ. It uses these inflammatory processes as part of the signaling for growing and shedding every month. And so it's not unreasonable to think that an immune response that involves a lot of inflammatory processes might disturb in some people these inflammatory processes for a couple of cycles after the vaccine.
And were the changes temporary or ongoing?
So we have just closed a follow-up survey that actually asks about this, that asks how many periods or for how many months people noticed any changes. We have not started to analyze that data yet, but anecdotally, what we suspect is that for most people, it's just 2 or 3 periods that they're noticing this. I would suggest if anyone is very worried they're bleeding a lot or it's going on for much longer, that they see their doctor, because there's probably something else going on that is not just this inflammatory response that we think is happening for some people with the vaccine.
Thanks a lot.
What would you like to know about COVID? Our science correspondent Derek Williams has the lowdown on the latest research and analysis. Just write to covidproducer@dw.com. This week we received a question from Maria Obdulia Robledo. Are there any risks for pregnant women who get vaccinated?
It's really great for a change to talk about something where experts are in such broad agreement. To start with, let's maybe approach this question from the flip side. Instead of asking whether there are risks to being vaccinated when you're pregnant, let's ask what the risks are if you aren't vaccinated. And there, all the evidence is really pretty unequivocal. Many studies have shown that if they catch COVID-19 while they're pregnant, unvaccinated women are a lot more likely to have severe outcomes than vaccinated women are. At this point, almost everyone agrees that getting the disease and having none of the immunity provided by vaccines, that can pose a major threat to both mother and fetus. That's why when it comes to COVID-19, most healthcare authorities now view pregnant women as a vulnerable group. But are there threats lurking in the background, adverse effects that maybe occur more frequently, or dangers? That's proven trickier to quantify because pregnancy is an inherently risky proposition. Even before the advent of COVID vaccines, miscarriages, for example, occurred about 10 to 20% of the time all on their own in women who knew that they were pregnant. But all the data that we have so far involving pregnancy and vaccination, and it's a lot, doesn't show an increase in that metric. Like everyone, pregnant women can and do experience mostly minor side effects after receiving vaccines. But according to the World Health Organization, Many pregnant women all over the world have now been vaccinated against SARS-CoV-2, and there have been no worrisome signs that it has affected either their health or that of their babies. In fact, the opposite could actually be true. There are some studies indicating that the antibodies that pregnant women produce after vaccination, that they not only help protect the fetus from infection with the coronavirus during the pregnancy, but also after birth. A fairly small one, cited on the CDC website, for instance, it tracked levels of antibodies in infants 6 months after they were born, and it found that the children of women who'd been vaccinated against COVID-19 during their pregnancy, that they appeared to be even better protected from the disease than the children of women who were infected with COVID-19 during their pregnancy. Many questions remain open, of course, but the advice has really evolved, and it's now pretty unanimous among healthcare authorities. If a pregnant woman hasn't been vaccinated yet, they say, then she should definitely take the step.
A lack of prospects in their own country is driving people around the world to look for work elsewhere. After some time in Chile, a young mother from Venezuela has been stranded in a town in northern Spain. But here too, almost a third of the population is threatened by poverty.
Lisca Sandoval never thought she would have to queue to meet her and her baby's basic needs. Nevertheless, COVID-19 left this Venezuelan mother without a job in Chile and forced her to migrate to Spain. Now she's one of the beneficiaries of an aid organization there.
I never thought of asking for help of any kind. If there had not been a pandemic, I wouldn't have had to come to the Cocina Económica for help.
The Cocina Económica, located in Santander in northern Spain, is a charitable organization that meets the basic needs of society's most vulnerable. Among their services, such as social dining or a hygiene facility, they provide food to more than 1,000 families monthly.
Because of the pandemic, more people come to the commissary and the canteen to meet their basic needs. Some people have survived until now thanks to their savings. We have people who had a stable economic situation, but because of the pandemic and its consequences, they're now in situations of exclusion.
More than 1 million people have fallen into poverty in the Mediterranean country. A recent Human Rights Watch report denounces the administration's failure to protect the most vulnerable.
People working in the hospitality industry, single parents, older people on state pensions really suffered during the pandemic as a result of the economic shock. Those people found themselves in a situation where they desperately needed state assistance through the social security system, and that assistance was very, very slow in coming and was very difficult to reach.
At the start of the pandemic, the Spanish government, like other countries, expanded existing unemployment support programs. But the furlough support left out people working in the informal economy and did not adequately cover those working seasonally or paid in part under the table. Another essential step was fast-tracking the introduction of the minimum vital income, a social assistance program introduced in May 2020, but it's only reached 9% of the people living at risk of poverty.
It's a basic, very, very basic, low-level social assistance scheme for people who haven't contributed to social security systems. And what it does is it gives a very modest, actually a tiny amount of financial assistance to people between 450 to 1,000 euros a month. What people found as they tried to apply for support through the system was a series of difficulties. First, in trying to apply, in trying to document their need, in the way the system calculated their level of need. It was a good system at some level, but it really failed on a number of bureaucratic levels and in terms of its implementation.
Spain is a relative latecomer among European countries in having a nationwide social assistance program. The experts agree it's closely linked to the increase of those who live at risk of falling into poverty. Koldo Casla, director of the Human Rights Center Clinic at the University of Essex, affirms that poor social protection is Spain's Achilles heel.
Creo que una sociedad rica como la española, la cuarta economía de la eurozona, no puede permitirse que haya personas que no tengan acceso a un nivel de vida adecuado, bien por ingresos o bien por prestaciones sociales. Las prestaciones sociales tienen que ser suficientes para garantizar un nivel de vida adecuado. Hay que poner fin a las trabas burocráticas, hay que proporcionar la ayuda antes de hacer un número infinito de preguntas y hay que evitar esas trabas administrativas sin mucha justificación.
COVID-19 not only brought consequences for people's health and pressure on the health systems, but also an economic storm that has wreaked havoc on the lives of the most vulnerable. Now, bold government actions are needed to ensure a better and fairer outcome.
In the midst of the pandemic, a woman in Ghana has set up a training programme for women living on the poverty line without any government support. As fashion designers, they now have the chance to make their own money. A real success story.
Bintu Baka lives in Shokor, a deprived community in Ghana's capital, Accra. She's a trained fashion designer and had been able to earn a good income from the profession. But then the pandemic hit, and her livelihood came under threat. Losing a secure source of income was challenging, she says.
So during the lockdown, being home, not getting any income, sure, whatever you save is what you have to use. And after you consume all, what are you going to do next? It means that you and your family won't get anything to eat, and you have to either beg someone for even food to eat, talk less of your house or wherever, your health issues and other things. So it was not that easy.
Baka and other workers were sent home in the middle of the pandemic after their employer, an NGO-run fashion business, suffered a sales slump and a sudden dip in funding. Patricia Wilkins is the founder of that NGO, which is called Basics International and promotes children's and women's welfare. She faced the task of keeping Baka and others in their jobs and keeping her organization from shutting down.
COVID obviously hit everyone by surprise, by a storm. It's not something any of us had maybe lived in a lifetime of. We heard about, so many pandemics that was so many years ago, but for us, it was a shock. So nobody knew what to do. Governments also had to rely on studies and react. So for us, I think we went through a panic mode like everyone, and we shut down.
Despite the financial pressures and great anxiety, Patricia Wilkins was able to reopen the NGO after only a short closure. Many women were dependent on her support and urgently needed food and shelter. Back at work, Baka and her colleagues expanded their fashion portfolio and began to make face masks. They then ventured into making items like cloth bags and pillowcases. Sales improved dramatically. Today, the business is able to sustain itself and its employees.
I'm feeling okay. I feel excited for the fact that I didn't lose my job and it's still going on. Because this is where, for me, I get my money to take care of myself, to pay my rent, pay other things, buy myself clothes and whatever I need. So to take care of my health as well.
In Ghana, the pandemic hit women particularly hard. 92% of women who have a job are in informal work. When an economic crisis caused that sector to collapse, there was limited government support to keep people afloat. The NGO Action Aid Ghana recently conducted research into the impact of COVID on the livelihoods of Ghanaian women. Its findings showed that they remain vulnerable.
Nationally, women fall within the informal sector. Now, this is a sector that does not have job security. This is a sector where happenings within the country can cause a closure to a business. And so if you have a higher percentage of your population being in that sector, and they are women, it clearly shows that once a pandemic strikes, they would definitely be the ones to bear the brunt of this pandemic.
But Patricia Wilkins is not giving up. Every day she works hard to keep her organisation up and running without any government support. Bintu Baka and the other women here can breathe a sigh of relief, knowing that for now, their income is secure.
And that's it for this week. Next week, we'll take a closer look at what side effects COVID-19 vaccines can have and whether, in some exceptional cases, they might last longer than expected. There are now years of research and analysis that can be drawn on. DW reporter Stephanie Zobel spoke with Klaus Kicutek, head of the Paul-Ehrlich Institute, to find out more. We look forward to seeing you next time. Stay healthy.